Hi, my name is Mina Boggs.
My name is Simaya Sanusi.
My name is Sadie Pates.
And my name is Júlio Valente Sanches.
There are over 30 million Americans who rely on insulin to manage their diabetes. Many of these Americans are forced to go without it because of how time-consuming and expensive it is. 1 out of every 3 U.S. adults taking prescription drugs says that cost has prevented them from taking their medication as prescribed. Now, imagine if we could cut the cost of insulin development, decrease its market price, and improve its efficiency. This life-saving medication would be accessible to so many more people. Our project explores the grand challenge, engineering better medicines, and proposes a solution to do just that. This is implementing crystalline insulin and Rosetta VS as a model for decreasing drug development costs. Specifically, we focus on low-income families in Robeson County, North Carolina. Robeson County is the largest county in North Carolina by land area, with 31% of its residents living in poverty and 23% lacking health insurance. The median household income is around $40,000, well below the North Carolina average. Additionally, Robeson County has the highest rate of diabetes in North Carolina, and a higher diabetes rate than the national average. These challenges, along with others, have made Robeson County one of the most disadvantaged areas in the state in terms of healthcare access, and low-income families are particularly in need of more affordable medications like insulin. Prescription drug costs in the U.S. are incredibly high, 2.78 times higher than those in other countries. Drug spending in the U.S. was $378 billion in 2021, which was around 9% of total healthcare spending. Many factors result in these high costs, but a huge factor is the astronomical cost of drug development and research. The median price of developing a new drug is $708 million, but in many cases it's in the billions. The most costly part of drug development is the clinical trials, and while expensive in and of themselves, the cost is exponentially increased by the number of rejected trials and drug candidates that don't make it through this stage. By designing a project that reduces the development cost of insulin and other drugs, we are addressing a major aspect of the grand challenge, engineering better medicines. Ultimately, the high cost of prescription drugs is a major healthcare barrier, and it most negatively affects low-income families. Families at or below the poverty level must spend 30% of their income on mid-priced drugs, while they must spend around 600% of their income on high-priced drugs. 85% of North Carolinians reported being worried or very worried about affording healthcare in the future, and 77% of North Carolinians said that they thought drug companies charged too much money. When drug prices are so expensive, families are forced to choose between medication or other necessities like food, and medication often isn't the priority. In Robeson County, 56% of people went without care due to cost, and 35 to 41% of low-income individuals did not fill a prescription, cut pills in half, or skipped a dose due to affordability issues. If the cost of drug development is reduced, this will allow prescription drugs to be more affordable to these consumers, making critical health care and treatments available to everyone, particularly to low-income families in North Carolina.
In order to solve this challenge, our team has come up with a solution that uses existing technologies as well as innovative technologies and political intervention. Our team has chosen to develop crystalline insulin using an improved drug development cycle. Crystalline insulin is designed to dissolve slowly into the bloodstream after injection, providing a sustained, prolonged effect rather than an immediate peak. Rosetta VS, which stands for Rosetta Virtual Screening, is a computational drug design platform, and it rapidly screens and optimizes potential drug molecules using computer simulation. Our cycle, which integrates Rosetta VS early in drug development, it increases the likelihood of candidates successfully passing clinical stages before it even enters human testing. Rosetta VS maximizes the probability of success by addressing 2 clinical factors that cause most drugs to fail in clinical trials. Number 1, poor effectiveness, and number 2, unacceptable pharmacokinetics, means it's unsafe or the body doesn't handle it well. While researching Robeson County, we found that it has the second highest rate of diabetes in the whole North Carolina, a whopping 13%, which is 3% higher than the state average. Additionally, about 22% of the population doesn't have access to health insurance, making it harder for them to afford the treatments they need. So by engineering a better form of insulin that will reduce the amount of times a person must inject themselves, as well as the amount of time spent in hospitals, we are cutting down costs, allowing for this new form of insulin to reach a larger number of the diabetic population.
In order to market our product, we plan on setting up educational booths to explain how our medication works. In our booths, we will target 1. The main concerns of our demographic, which is why is medication so costly today? One of the reasons is because of how costly the clinical trials phase of production is. 2. Defining our unique proposition. We will specify how normal insulin medication works versus how ours works and why it is better due to being able to be less time-consuming as well as less costly. 3. Promote our usage of AI technology. We will explain how we use Rosetta VS in order to cut down production costs in clinical trials. We will also explain why Rosetta VS should be used in the production of other medicines in order to cut their costs as well. We will also provide our website, which details the process of using Rosetta VS, as well as other details on our crystalline insulin. While using Rosetta VS allows for us to reduce the costs of developing medications, and developing crystalline insulin allows for easier access to life-altering medication for the diabetic population, our overall goal to reduce the prices of medications will not be able to be achieved without political intervention. With political intervention, we will be able to lower costs for a wide variety of medications, allowing for larger access to healthcare for low-income families. Our team plans on meeting with political powers in North Carolina, such as Dr. Devduta Sangvi, who is a member of the North Carolina Medical Board, Greg Murphy, who is a representative of the North Carolina General Assembly, and Lawrence Greenblatt, who is NCDHHS's State Health Director and Chief Medical Officer. Our team will explain in detail how Rosetta VS works, as well as use data collected during production to show how using Rosetta VS is able to cut down the costs of production. We will then advocate for Rosetta VS to be used in the production of other medications in order to lower production costs, thus lowering the cost of medication.
Our visual component shows our visions for the new and improved drug development cycle. We aim to use Rosetta VS throughout the process, starting from identifying what drug mixture will be the best to solve the problem we face. We also aim to have one less human clinical trial, substituting that for 2 Rosetta VS computer simulations and data analysis. Lastly, we aim to have Rosetta VS monitor the drug post-launch to ensure it is working as it should. If you need any more information about our project, we have a more detailed description in our website. All you have to do is scroll down and click either in the Rosetta VS or in the crystalline insulin buttons depending on what you want to know more about. We also have a visual pamphlet which we plan to hand out during our educational booth. With all of this stated, our next steps for this project will be definitely be improving the idea and figuring it out if it could ever be practical. First, we will need to research existing glucose-responsive insulin systems to understand what has already been tried and what problems other researchers had. After that, we could have to find better materials that could stay stable in the body for weeks without being affected by the immune system. We will also need to develop a safer glucose sensing mechanism, since the whole design and safety of the patient depends on accurate detection and release. We will also have to work on models or solutions to find out how much insulin should be stored, how fast it should be released, and how long the system could last. We will also need to think about safety features in case something goes wrong.